Have you been feeling unusually thirsty, tired, or needing to urinate more often than usual? These symptoms may seem harmless, but they can sometimes be early signs of diabetes. Diabetes is one of the most common chronic diseases worldwide. It occurs when the body cannot properly regulate blood sugar, also known as blood glucose. Over time, high blood sugar can damage many organs, but with early diagnosis and proper treatment, most people with diabetes can live long and healthy lives. Today, we'll discuss the warning signs of diabetes, when high blood sugar becomes a medical emergency, the serious complications that can occur if diabetes is left untreated, and the most important steps to stay healthy. Glucose is the body's main source of energy. After you eat, carbohydrates are broken down into glucose, which enters the bloodstream. The hormone insulin, produced by the pancreas, helps move glucose from the bloodstream into the body's cells, where it is used for energy. In diabetes, the body either does not produce enough insulin or cannot use insulin effectively. As a result, glucose builds up in the bloodstream instead of entering the cells. There are several types of diabetes. Type 1 diabetes is an autoimmune disease in which the body's immune system destroys the insulin-producing cells of the pancreas. People with type 1 diabetes require lifelong insulin therapy. Type 2 diabetes is much more common. In this form, the body becomes resistant to insulin, and over time, the pancreas may not produce enough insulin to keep blood sugar under control. Gestational diabetes develops during pregnancy and usually resolves after delivery, although it increases the future risk of developing type 2 diabetes. Many people develop symptoms gradually, especially those with type 2 diabetes. Common symptoms include frequent urination, increased thirst, increased hunger, unexplained weight loss, fatigue or low energy, blurry vision, slow healing cuts or wounds, frequent skin, urinary tract or yeast infections, dry mouth, dry or itchy skin, tingling or numbness in the hands or feet. These symptoms occur because the body cannot properly use glucose for energy, while excess glucose is removed through the urine, causing dehydration. Some people with type 2 diabetes may have no noticeable symptoms for years, which is why routine screening is important for individuals at increased risk. Persistently elevated blood sugar damages blood vessels and nerves throughout the body. Without proper treatment, diabetes increases the risk of heart attack, stroke, chronic kidney disease and kidney failure, diabetic eye disease that can lead to vision loss, nerve damage, called diabetic neuropathy, poor wound healing, foot ulcers, and serious infections. Many of these complications develop slowly over time and may not cause symptoms until significant damage has occurred. Keeping blood sugar, blood pressure, and cholesterol under good control greatly reduces these risks. One of the most serious complications of diabetes is diabetic ketoacidosis, commonly called DKA. DKA occurs most often in people with type 1 diabetes, but can also occur in some people with type 2 diabetes. When the body does not have enough insulin, it cannot use glucose for energy. Instead, it begins breaking down fat. This produces substances called ketones. As ketones build up, the blood becomes acidic, leading to a life-threatening medical emergency. Symptoms of DKA include extreme thirst, frequent urination, nausea and vomiting, abdominal pain, deep or rapid breathing, fruity smelling breath, severe weakness, confusion, difficulty staying awake. Without prompt treatment, DKA can progress to coma and death. Another dangerous emergency is Hyperosmolar Hyperglycemic State, or HHS. This condition occurs more commonly in older adults with type 2 diabetes. Blood sugar rises to extremely high levels, causing profound dehydration without the significant ketone production typically seen in DKA. Symptoms include extreme thirst, very high blood sugar, severe dehydration, confusion, difficulty speaking, weakness, vision changes, seizures, loss of consciousness. Like DKA, HHS requires immediate emergency treatment. Seek emergency medical care immediately if you or someone with diabetes experiences difficulty breathing, persistent vomiting, or inability to keep fluids down, moderate or high ketones if advised to check them, severe dehydration, confusion or unusual drowsiness, loss of consciousness, fruity smelling breath with high blood sugar that remains very high despite following your treatment plan, especially if accompanied by concerning symptoms. If you experience chest pain, symptoms of stroke such as sudden weakness or difficulty speaking, or severe shortness of breath, call your local emergency services immediately. The good news is that diabetes can often be managed very effectively. The most important steps include: take your medications exactly as prescribed. If you use insulin, do not stop taking it unless specifically instructed by your healthcare provider. Monitor your blood sugar as recommended. Eat a balanced diet rich in vegetables, fruits, whole grains, lean proteins, legumes, and healthy fats while limiting sugary beverages and highly processed foods. Aim for at least 150 minutes of moderate physical activity each week, if appropriate for your health. Maintain a healthy weight if recommended by your healthcare team. Stay well hydrated. Avoid smoking and limit alcohol according to your healthcare provider's advice. Schedule regular medical visits. Routine eye exams, foot examinations, kidney function tests, and blood pressure checks are essential because complications can often be detected early. During illness, monitor your blood sugar more frequently and follow your healthcare provider's sick day plan. People who use insulin may also be instructed to check ketones during illness or when blood sugar is significantly elevated. Diabetes is a serious condition, but it is also one of the most manageable chronic diseases when diagnosed early and treated consistently. Recognizing the warning signs, monitoring your blood sugar, taking medications as prescribed, maintaining a healthy lifestyle, and knowing when to seek emergency medical care can help prevent serious complications. If you think you may have diabetes or your symptoms are worsening, don't ignore the warning signs. Speak with your healthcare provider as soon as possible. Early diagnosis and proper treatment can protect your heart, kidneys, eyes, nerves, and overall quality of life. This video is intended for educational purposes and should not replace personalized medical advice. If you have symptoms of diabetes or think you are experiencing a medical emergency, seek care from a qualified healthcare professional immediately.